Hi everyone, my name is Kristy Ho, and today's presentation is going to be on Alzheimer's disease. This is more specifically going to focus on its mechanisms of development throughout the human body and its correlation with patients' health outcomes. Okay, so first things first, we're going to look at an overview of what Alzheimer's disease actually is. It's one of the most common causes of dementia worldwide, affecting 60 to 80% of dementia patients. Alzheimer's is a progressive and irreversible neurodegenerative disorder, meaning that the brain cells gradually become damaged and they die over time. So one of the biggest causes of this damage is the buildup of abnormal proteins within the brain. This can include beta amyloid forming plaques between the neurons or tau tangles within the neurons. These two complications disrupt the communications between the brain cells, and eventually they'll lead to widespread death of the neurons and brain shrinkage. In early on stages, Alzheimer's patients will experience memory delays, but as it progresses, it also impacts reasoning, language, personality, and even the ability to carry out daily tasks such as writing, answering the phone, or even making the bed. So usually Alzheimer's will present itself in 3 stages, including the early stage, the middle stage, and the late stage. Because this disease progresses over many years, it leads to complete loss of independence. Alzheimer's is not only a medical issue, but it is a major public health and economic concern affecting families and healthcare systems. So the earliest and most prominent clinical manifestations of Alzheimer's disease is progressive impairment of short-term memory within patients, particularly difficulty forming and retaining new information. So as this disease begins to progress within patients, there is a measurable decline in the executive function, and this can include impaired reasoning, judgment, and problem-solving abilities. They may also struggle with planning, organizing, and completing multi-step tasks. Another symptom that some patients might face is visuospatial impairment that may develop, leading to disorientation and difficulty navigating familiar environments. In regards to the neuropsychiatric and behavioral disturbances, they usually emerge during the middle stages. These disturbances can include apathy, depression, irritability, agitation, and social withdrawal. In terms of risk factors, advanced age is the most significant non-modifiable risk factor. The incidence increases substantially after the age of 65. Genetic susceptibility also contributes, particularly in individuals with family history of Alzheimer's disease. Finally, cardiovascular and metabolic conditions such as hypertension, diabetes, obesity, and smoking are also associated with elevated levels of risk, likely due to their impact on their cerebrovascular integrity and neuronal health. So what really happens within the brain of Alzheimer's patients? One of the earliest pathological features is the accumulation of beta amyloid protein fragments. These fragments cluster together to form plaques in the extracellular space between the neurons, and then the plaques interfere with the normal synaptic communication that trigger inflammatory responses. Within the neurons, another abnormal process occurs involving the tau proteins. Tau normally stabilizes the microtubules, which help transport nutrients and essential materials within the cell. We call these tau tangles, and they usually disrupt the internal transport system, ultimately leading to neuronal dysfunction. When these plaques and tangles accumulate, the synaptic connections are lost within the brain. Communication between neurons becomes impaired, and then the cells begin to degenerate and die. Overall, the widespread neuronal loss results in visible brain atrophy and a measurable reduction in overall brain volume. So although Alzheimer's disease begins in the brain, its effects eventually extend throughout the entire human body. As the cortical and subcortical regions deteriorate, motor coordination declines within patients. Dysphagia or difficulty swallowing is common in later stages due to impaired neuromuscular coordination. Other effects can include malnutrition, unintended weight loss, neurological decline, and mobility decreasing. All of these effects together increase the patient's susceptibility to infections and more complications. So to diagnose Alzheimer's disease, clinicians usually start with a detailed medical history. They ask about when symptoms began, how they've progressed, and how they're affecting daily life. Brief screening tests are commonly used to evaluate memory, attention, and orientation. Doctors may also evaluate how well the person can perform everyday tasks such as managing money, preparing meals, and taking medications. Loss of independence in patients is a key feature of Alzheimer's progression. Mood and behavioral changes are also assessed because depression, anxiety, and other conditions can affect thinking and may either mimic or worsen the cognitive symptoms of Alzheimer's disease. Finally, doctors use blood tests to rule out any other medical problems such as vitamin deficiencies or thyroid disorders that could cause similar symptoms to Alzheimer's disease. Neuroimaging and biomarkers allows clinicians to examine the brain structure and in some cases even its function. Clinicians use MRI scans, CT scans, PET scans, all of these scans to see the actual physical condition of the brain. So when it comes to prevention and risk, there is currently no cure for Alzheimer's disease. However, research has suggested that certain lifestyle behaviors may reduce overall risk or delay of Alzheimer's. A couple of the preventative measures that a patient could take is regular physical activity, cardiovascular health, cognitive stimulation, things such as learning a second language, keeping a balanced diet, engaging in social activities, and keeping a proactive management of chronic medical conditions play an important role in reducing modifiable risk factors in Alzheimer's. So age is the strongest demographic factor associated with Alzheimer's disease. The risk increases significantly after the age of 65, and it's most prevalent in individuals over 85. Overall, women are more frequently affected by Alzheimer's disease than men, and there's also a higher prevalence in certain racial and ethnic groups. So when it comes to diagnosis, treatment, and care, individuals of a higher socioeconomic status may have more access to these resources. So with ongoing studies of Alzheimer's disease, what we really need to focus on moving forward is early diagnosis and detection of Alzheimer's. This is important for identifying cognitive changes before significant decline, allowing patients and families to plan care and make legal and financial decisions for treatment and slower progression. Thank you for listening to my presentation.